Each of our 6 panelists will talk 4 or 5 minutes. Once they finish, the panelists can respond to each other's comments. Then we'll devote 30 or so minutes to questions from all of you might have, those of you tuned into the webinar. You can ask questions in 2 ways, by typing them via the chat feature on the bottom of the screen, or second, by clicking the raise your hand icon. We recommend that you ask your questions via chat because that's way easier for us to field and keep track of. And tell us to whom you want to address your question. Today's panelists are Michael, I'm going to mispronounce your last name, Hedeka, an associate professor of sociology at Drake University in Des Moines, Sheriff Tony Thompson of Black Hawk County, Iowa, Christina Ortiz, an assistant professor of anthropology at the University of Minnesota, Mark Lauritsen, director of the Meatpacking and Food Processing Division of the United Food and Commercial Workers International Union, Karen Tynan, an attorney with the Ogletree Deakins Law Firm, and lastly, Debbie Berkowitz, former OSHA Chief of Staff and currently Director of Worker Safety and Health at the National Employment Law Project. I should note that Sheriff Thompson can only stay with us for 30 minutes. I also want to thank Joel Gershenfeld for all his help on this. We should all thank the Labor and Employment Relations Association for sponsoring this webinar. Several of us thought it would be worthwhile to organize a webinar on the meatpacking industry and COVID-19 because of the dismayingly large outbreak at numerous beef, pork, and poultry plants. That raises important questions, not just about worker safety and health, but also about industrial and labor relations in general. 8 workers have died at the JBS beef plant in Greeley, Colorado, where at least 366 workers have tested positive. There have been over 700 cases at the Tyson plant in Perry, Iowa, where 58% of the workers tested positive. There have been at least 800 cases at the Smithfield plant in Sioux Falls, and at least 890 at the Tyson plant in Logansport, Indiana. At Tyson's pork plant in Waterloo, Iowa, at least 1,031 workers have tested positive. Sheriff Thompson played a major role in pushing that plant to close for a while. Today we will discuss why has COVID-19 become so bad in this particular industry. Was it too hard for industry officials to see the magnitude of the problem in advance? Was the industry inexcusably slow in acting? Was the industry putting profits over workers' health, as some contend? Was the virus spread mainly by, quote, home and social conditions, as the governor of South Dakota and HHS Secretary Alex Azar have suggested? And what about President Trump's executive order invoking the Defense Production Act to order meat plants to stay open even as COVID-19 has swept through the industry? So lots of interesting stuff to discuss, and we will begin with Professor Hedeka. Thank you.
Thank you, Steve. I think I had a slide. I'm not sure if it's being shown right now to everybody on the call. And it's the next one. So I'm really, really pleased to be here, and really honored to be part of such an excellent panel of speakers. I'm going to take my 5 minutes, and I'm starting a timer right now, so I should be able to keep to that 5 minutes, just to provide a bit of a historical perspective on the situation that we're experiencing now. As Steve noted, most of the cases that have been diagnosed have been at large, very large meatpacking plants, such as the one in Sioux Falls, South Dakota, several here in Iowa, where I work. Those plants have conditions, working conditions that make the spread of coronavirus likely. I think that the idea that exposure at work is not primarily responsible for the outbreaks at meatpacking plants is perhaps not the most well-informed analysis of the situation. So what I want to do today is talk about some of the conditions, the origins of the conditions that make that spread likely. And I want to focus primarily on industry restructuring that happened in the 1970s and the 1980s, and three dimensions of that industry restructuring: the ruralization of the industry, the consolidation of the industry and meatpacking firms, and also changes in the workforce dynamics. Those things are largely responsible for the very large plants that we see today, the ones that are at the epicenter of the outbreak. So one of the things, this first factor that happened in the 1970s and the 1980s, was a shift in the meatpacking industry from an industry located in metro areas like Chicago and Kansas City to one located in small towns in places like Iowa, Colorado, South Dakota, also in the rural Southeast. That shift took place really for three reasons. One was an effort on the part of firms to lower labor costs by moving to places where workers were not used to such high wages and also where unionization was not so strong. Another reason was to locate closer to the source of animal supply, so as opposed to being close to the railway hubs that have been so important for the industry in earlier years, moving to rural areas where they were closer to stockyards, closer to places where the animals were raised. That was one shift that took place, and that had an impact on the ability of the workforce in meatpacking plants to exercise control over the process of work in those plants. Rural areas were harder to unionize. There was less experience with unions. There was also an anti-union sentiment in many of the places where the industry moved to. That was one of the major changes in this period of industry restructuring. A second was the consolidation of the industry, and I mean that in two senses. One is the emergence of a few firms as leaders in particularly the beef industry, but also the pork industry, and a shakeout which led to other smaller firms closing, going out of business. Another way in which I mean consolidation is a shift from smaller plants to larger plants that were really focused on achieving economies of scale, primarily by speeding up the work process, by speeding up the line, the disassembly line that exists in those plants, and also by subdividing the work process down finer and finer so workers were doing only a few very repetitive tasks and so could be switched out easily, could do those tasks very quickly and be switched out easily. Also a change that reflected the challenges that organized labor was facing in the industry and also worked to make a unionization yet more difficult in the industry. And then the third big change that has shaped the industry that we have today is a change in workforce demographics. In particular, what I mean is a growing proportion of the workforce in these large meatpacking plants is composed of workers who, for one reason or another, are facing situations of greater vulnerability, few other options for work in these towns where the industries are located. So we've seen an increase in the number of workers who are refugees, who are obligated to find work, become self-sufficient as quickly as possible, and are often steered to working in meatpacking plants as a relatively easy way to find work. Also, a growing number of first-generation immigrants from Mexico and other Latin American countries who are here either on provisional work permits, such as the Temporary Protected Status Program, or have authorization to work but are not citizens, or people who don't have legal authorization to work, or a growing proportion of workers in the meatpacking industry. These workers are perhaps less familiar with US labor law, US labor protections, and are certainly more vulnerable, and so are less able to contest the conditions that they're experiencing in those plants. So I wanted to go through those three changes. I'm at the end of my time now, so I'll stop there, and thank you very much.
Thank you, Michael. Sheriff Thompson, we look forward to you telling us about what you've seen, experienced in Iowa.
So I think it's wise that I start off by explaining that I'm certainly not going to wow you with a lot of, urethral kind of, analytical kinds of comments here. My approach to this was very non-scholarly. We stood up our Emergency Operations Center here in Blackhawk County in March rather. And come mid-April, we started getting complaints about businesses that were not practicing what we were telling the public to be doing. Masking, social distancing, those kinds of things. And so we had been on television telling people these best practices, trying to stand up our defenses here in Blackhawk County for what we knew was coming from the East Coast. And the largest complaints that we were getting were about the Tyson plant here in Waterloo. And so within about 2 or 3 days of getting a large number of complaints and concerns about the Tyson plant, we reached out to them and asked if we could come visit them. So on April 10th, we went into that plant. Upon visiting that plant, obviously it's been well publicized that we did not see what we would have liked to have seen, and a dumb knuckle dragging cop went in there and saw people reaching over each other and working elbow to elbow and shoulder to shoulder, and not able to social distance in their locker room, not able to social distance in their break rooms, at their cafeteria. I saw people, only about a third of them even wearing PPE of any kind, and all of it was homemade, handcrafted, bandanas, things of that nature. And we walked out of that plant knowing that they already had some COVID positive patients there, totally devastated, knowing that this was 2,800 citizens of Blackhawk County that were going to predicate community spread everywhere. Now, having reflected on that and having spoken about it many, many times, I was cautioned, why in the meatpacking industry and not, we've got 4 or 5 John Deere plants here in Waterloo. Why not at the cabinet making factories down the road? Why in the meatpacking industry? And the biggest thing that hit me as an elected official was, why did I turn such a blind eye to this industry? Why was I not paying attention? Why was I not picking up on this more quickly and paying attention to it? And the only thing that I can really validate or justify in my own thinking about everything that's transpired is, I think society has this blind spot when it comes to meat production, because it is very medieval. Right? We take an animal and we hang it and we cut it and we have it bleeding, and the processes are very archaic. They're just they're sad, and the people that do that work, I think, get caught in that blind spot. And so I experienced that implicit bias just like everyone else. And so when I walked out of that plant on April 10th, I was disgusted by what I saw, but I was more disgusted that I didn't pick up on it sooner, that I wasn't there speaking for these people that obviously didn't have a voice, that didn't have the benefit of being represented, or didn't have the benefit of being protected, better protected. And so from a public safety perspective, which again, this is a weird, strange, wackadoodle arena that I'm currently operating in from the realm of public safety, I found myself lacking. I found myself missing the boat. I found myself really disgruntled that I missed the mark. I've left 2,800 people behind. And that's what motivated me to get so involved and to get so aggressive. And then as Tyson started to ramp up their PR campaign nationally, I recognized that if they wanted to fight, we were going to have to fight on a national scale, not on a local scale. I wasn't going to be able to go to the local plant manager. That fell on deaf ears. I wasn't going to be able to go to the governor. That fell on deaf ears. So we had to ramp up on a scale that if we were truly doing battle, if we were truly trying to shut down this COVID virus and protect the 135,000 citizens of Blackhawk County, I was going to have to battle on a very large stage. And we did that. So it was a very strange, like I say, a very strange arena to be fighting in, but one that was well worth the time, and one that motivated me very differently, simply because I felt like I had let people down. I had let a certain part of that population down.
Jeff, you very nobly criticize yourself for not doing more for the workers. What more do you think Tyson should have done to keep things from getting so out of control?
Well, we've been talking about COVID-19 since January, since December. This is a global company. This is not just a local mom and pop, organization. This is an organization that is global. Most of the meat that comes out of our plant ends up going to China to be finally processed, not here in the United States. So we're talking about a global company that had more than enough awareness. Just because Blackhawk County stood up their emergency operations center in March doesn't mean that we weren't paying attention to this. We weren't talking about the coronavirus clear back in January. I just fail to believe that they couldn't have gotten some masks and gloves and some sort of protective equipment for their employees that they say publicly that they value so highly. This could have been so easily prevented. And quite frankly, the reason that we went into that plant was because people were listening to us. When we went on television and said, listen, citizens of Blackhawk County, here is how you prevent this. Here is how you protect yourself. Here is how you protect your family. And then these people are going to work and they're not being protected. They're calling and tattling to me saying, hey, I feel safe when I'm at home, but I certainly don't feel safe when I go to work. And that's what we followed up on. So, and lo and behold, it was true.
One more question before we turn to Professor Ortiz. So did you get a lot of pushback from, when you sought to shut the plant, did you get a lot of pushback from Tyson and from the governor? And how does President Trump's executive order to keep plants open fit into everything?
So there was pushback everywhere. There was pushback from the governor's office. Obviously, there was pushback all over the place, but at the end of the day, I've got to live with myself. I've got to live with knowing that you're representative of 135,000 people, whether they buy into the coronavirus or not, whether they believe that this is a dangerous, deadly virus or not, you're out there trying to protect them. And this was an enormous hole in our defenses that I had to shore up. And when the DPA came out from President Trump, to Tyson's credit, they weren't ready to open up yet. Not because they didn't have things disinfected at that point. They didn't have all their protective measures, everything fabricated and hung yet, but they didn't have the workforce. They didn't shut down because I necessarily shut them down. They shut down because they ran out of staff. They got to the point where they were non-mission capable. They just ran out of people to be able to run the lines. When that DPA came out, they still didn't have enough that had either been over the quarantine period or were not recovered enough to be able to go back to work.
Thank you very much, Sheriff.
You bet.
Professor Ortiz. Christina.
Yes, thank you. I'm so happy to hear from Sheriff Thompson because it is the perfect lead-in to what I wanted to say and was having trouble figuring out the setup for. So I'm also going to put a little 4-minute timer so I don't go too far over. So my takeaway from, so I'm an anthropologist, I'm a cultural anthropologist, and my experience with living in upper Midwest meatpacking communities has been that meatpacking is not just about the industry, it's about the whole community. And in some cases, transnational communities, right? So that you have people in other countries whose lives and homes depend on the livelihoods and existences of people in places like Perry, Iowa, and Waterloo, and these kinds of things, right? But also, if we take that same big picture lens, we can look at meatpacking as just a contemporary iteration of a model of extraction, of food production extraction that has existed in the Midwest since colonial settlement, right? So I'm speaking to you from the University of Minnesota Morris, which is on the ancestral lands of Ojibwe and Dakota people, right? And since that time of settlement by colonial farmers, right, we can see how rural extraction is baked into the way that we get our food and the way that we distribute our food. And that has an impact on whole communities of people, not just individual towns, right? And so even though the meatpacking plant is really important and really central and, you know, the economic motor of a lot of these communities, it also has ripple impacts well beyond just the meatpacking plant, right? And rural communities are vulnerable in multiple ways, right? So not just racially, not just geographically, not just politically, right? We're statistically insignificant, right? We are vulnerable in front of these really well-organized, well-funded multinational corporations. So we have very little leverage by which to demand anything from these companies. And since the 1990s, these companies have used the threat of, oh, well, we'll just relocate to some other small town, because the calculus in rural communities is not these jobs are better jobs, it's these jobs are no jobs. And so we're talking here about whole communities that are sort of struggling with multiple vulnerabilities and all different kinds of invisibility, particularly for immigrants and refugees and Black and brown people, but also for across the whole community. How do they get mental health access? How do they get actual clinic health access resources, right? So much of that is built on multiple and intersecting vulnerabilities that have to do with the economy and the power of multinational corporations that are using those vulnerabilities as part of their business model to extract resources from rural spaces. And so what do we do with that? Well, the hopey changey part of me is inspired by the different kinds of solidarity and resilience that I see, right? From community members who are like, oh, we had a flood and we got together and we sandbagged all our neighbors' houses, to in a situation like COVID, people like Sheriff Thompson saying, what can I do? How can I protect the people in this particular community? But what COVID has also done is highlighted how we as individual communities need to see ourselves together and build solidarity amongst each other in order to have relationships of better or more equality with these big, well-organized multinational corporations that are really deciding what happens in our communities on the ground. And I think even though COVID is a disaster and an emergency and all these kinds of things, if something good can come out of it, seeing one another, is one of the things that we can build on from this disastrous situation. And I'll stop there.
Thank you very, very much. Thanks, Christina. So Mark Lauritsen, your turn at bat, sir. I think you need to unmute, Mark.
Very good. Thank you. Thank you for hosting this, Steve. Listen, first of all, I would like to say it's nice to be on a panel with a bunch of Iowans. I'm a Iowa hog slaughterhouse worker. It's where I got my start in my career. I worked at the hog slaughtering plant in Cherokee, Iowa at the time, and now I'm the UFCW's Director of Food Processing and Meatpacking. With no doubt, the coronavirus has been an unprecedented challenge for all the workers in the meatpacking industry. In the decades that I've been doing this, I don't recall a larger challenge that was faced by those workers in those meatpacking plants. Nothing that I can think of even comes close to what it is. And I think everybody needs to remember that these workers in these meatpacking plants, which kind of to what Sheriff Thompson had said, these have always been these invisible workers. But they are the most hardworking, dedicated, and in this particular case, the most brave workers that they're out there. And I don't think enough can be said about their courage and dedication. But the fact is, we can't continue to sacrifice the health and potentially the lives of these workers just to feed our neighbors and do nothing about making it safer. Our union has been relentless across the country to try to improve worker safety in these plants. I literally do not doubt the sincere effort of every union activist, union steward, local union president, and local union across the country, and the work that they've done to try to make these plants safer in these unprecedented times. And the work that they're doing doesn't just affect those union plants, it also affects those non-union plants that are out there. These improvements could have been things that we've achieved, like enhanced sanitation, the temperature checks, enhanced employer PPE, the social distancing that's taking place now on those plant floors. That's all stuff that we had worked with our employers to bring about. And quite honestly, our union has not hesitated to call for the closure of a plant if we think it's necessary to ensure the workers' safety. We've worked for things like expanded leave language, expanded the healthcare access for workers in the plant in the face of the COVID-19 outbreak. And what this means, though, I think it actually means that today, a union worker is actually going to be safer than a non-union worker in this industry. Now, the work's had challenge. We have had some reluctant employers, government officials at all levels. They haven't prioritized these workers, and they have not prioritized their safety. And quite frankly, in some cases, I don't think they've taken the virus quite seriously. We've had federal agencies that have just checked out in the face of this pandemic, to the extent where workers are now being sacrificed because of their lack of activity. But when the UFCW is if I reflect back, I'm actually proud of where we've come from where we were in, let's say, late February or early March. Everything we've gained for our members in this industry has been earned. Nothing's been given, nothing's been just handed to them. It's all been earned by those workers, and they deserve every protection that they can get. And unfortunately, in the industry, in the union, in the government, we have not always succeeded. Quite honestly, every worker that gets sick, and unfortunately, every worker that's died, it's just an unspeakable tragedy. And one is too many. In our union family alone, too many have been affected. We've had 35 members, more than 35 members that have died in meatpacking across the country. And we've had over 3,300 of our members directly impacted who work in the meatpacking plants. Unfortunately, a lot of this has come due to the complete failure of the government. And later I can go into how I think our government has absolutely abysmally failed to protect these workers. On many levels, workers and their unions are the only ones that were fighting for the protections of workers. We've been pressuring state governments and city governments to protect these workers. It is because we have no federal response, we have to now look to state and local governments to actually protect these workers. And we shouldn't have to be in that fight. And hopefully after this webinar, we don't have to be in that fight alone. But oftentimes it feels like if you're a worker in a meatpacking plant, you feel like you are in it alone. The bottom line is this. The president invoked his executive order in the Defense Production Act because he wanted to protect the food supply chain in this country. If you want to protect the food supply chain in this country, you do it by one way and one way only. And you do it by protecting those workers in those meatpacking plants. When you do that, when those workers are safe, our food supply chain will be safe. But quite honestly, folks, we got to have our state and our federal and local governments, especially the federal government, has got to step up to ensure the safety of these workers. So I'll stop there and let you go from there.
Thank you, Mark. We'll ask you later more about the government's role or lack thereof. Karen Tynan, thanks for joining us all the way from Sacramento. So the floor is yours.
Well, gosh, I'm not from Iowa, but I'm originally from Georgia, talking to you from out here in Sacramento. And I want to tell you a little bit about what my typical day is like, advising employers about COVID, what I've been trying to do, how I gather data, what I'm focusing on. And first, I'd like to agree with Mr. Lauritsen. When I saw an order about keeping meat processing open, I thought to myself, well, you can, my years in the Merchant Marine, you can wish in one hand and do something in the other, right? So I know that the best way to keep a meat processing plant open is to have healthy workers. And so my day is typically a lot of advice, working with everybody from construction companies, healthcare, the meat processing, agriculture companies on COVID-19. It really ramped up in March as we kind of started knowing a lot more about transmission, exposure, tracing. Every day I check the Department of Labor OSHA establishment search website, and I look and see what kind of establishments have inspections started. And I try to look for trends. I try to look to see if inspectors are opening inspections on particular industries. And certainly inspections are being technically opened in meat processing. I think that a lot of that is remote inspections. I've done one myself. And so I look at that data. I see a lot of healthcare inspections, especially in the Northeast. And then now across the whole country, I'm seeing more inspections, and I look for the fat cat, fatality, catastrophic, or accident category. And when I see, let's say, a meat processing employer or a healthcare employer, I pretty much assume that's related to COVID-19. I can't really, see with this number of inspections that's related to anything else. And so I'd like to tell you a little bit about a remote inspection I did for a meat processing plant where an inspector could not go out because they were told they couldn't because of COVID-19. And we did a remote inspection. We provided employees to be interviewed. We were instructed to go take particular photographs of areas of equipment, of certain locations, and certain employees doing tasks, and provide that to the inspector for their analysis. And really also the other part of what I'm doing is working with employers to focus on the hierarchy of controls for those safety nerds out there. I think giving people N95 masks, slapping on their face is not enough. We've got to look at engineering controls, administrative controls, those ways that are more effective for minimizing exposure to COVID-19. And I'm even actually have a project right now where I'm working with a canine facility that has bomb sniffing dogs and narcotic sniffing dogs to get the scents from either Penn State, Auburn, or there's another school that has it, so that dogs can be trained to sniff COVID as another tool that we can use. So that's kind of what my day is. And I thought sharing that and how I'm trying to analyze and help employers and workers would be helpful in this conversation.
Thank you, Karen. Thank you very much. Debbie, you can be the closer.
Hi, everybody. I'm going to put my timer on as well because I can speak for hours on this. So for people that don't know me, I've been doing worker safety and health, been an advocate for worker safety and meatpacking since the late 1970s. I was once the UFCW Health and Safety Director. I was more recently in the Obama administration, the OSHA Chief of Staff and Senior Policy Advisor in the last 4.5 years. I've been at the National Employment Law Project. So I'll be the closer. And I think what I'll do is make some bullet points here. If I was, giving you a presentation by email, so I can just focus on some key points I think is important to know. And that is one, both Tyson Foods in their ads in the Washington Post, the New York Times, and then the president, who just listened for some reason and followed up with an executive order, presented a false choice to all of us that you could either feed America or you can keep workers safe. And the president and Tyson decided we need to feed America, but that's a false choice. We can and we must do both, and a caring industry would have done both from the beginning. The part of this point is also that the executive order that was issued was completely misrepresented by the press when it first was published, because the press aren't lawyers or they're just wonderful, smart reporters, and reported what the president said. But you need to know that nothing in the executive order claims any power to force plants to stay open, and nothing in the stated sections on which the order purports to rely delegate such authority to anyone. So it was more bluster. It was to give cover to this industry to be able to say, we can stay open. We can stay open regardless of what protections we put in place for workers. I just want to make that clear. The second thing I want to make clear is there was nothing inevitable about the meat industry that would have created these hot spots in the industry. Nothing about the actual meat itself, nothing about the cold conditions, and nothing about the kind of workers that are in these plants. That the reason it spread in these plants is because the industry, the meatpacking industry, decided not to implement the basic guidance from CDC, which is why you and I are all Zooming around to keep 6 feet apart. Later on, a couple of weeks later, and the end of March, they said people should be in a mask, stepped up sanitation, deep cleaning when there's a case. What you saw in the meat industry, and you've heard, from Michael so beautifully, is what conditions are like in these plants. And from the sheriff, workers work shoulder to shoulder, especially in the fab side of the plant, which is the largest. They have, scissors or knives or tools. They make 5,000 to 10,000 of the same cuts every day. They crowd into break rooms, they crowd into locker rooms. And so you had the conditions right that just one person, a supervisor, could have brought it in and it ripped around the whole workforce. So I want to make it clear that it was a decision by the meat industry not to implement these basic conditions, because the production is king, line speed is king in this industry. The speed of the line and the profits are king, not feeding America, but their profits. And I just want to make that clear. And as a result, you now have, as of today, and this is, we don't know how accurate it all is, but because it's unclear what gets reported to the government, but over 16,000 meat packers are infected, and we have 64 dead. I want to also say that the federal government has completely failed here. Federal OSHA did not issue any specific standards, any requirements for the meat industry, and they're not enforcing the CDC guidelines. So unless a governor puts in, or a city puts in protections, there are no protections. So looking at OSHA citations or looking where OSHA is going is not going to make workers safe, because they haven't done hardly any inspections. They got 4,000 complaints and sent letters to various industries. This is a dangerous industry. It has always been dangerous. It has an injury rate of almost 2 times the national average, an illness rate of 15 times. Why anyone would think an industry that never prioritized worker safety voluntarily would do it now, I have no idea. And I also just want to let everybody know out there that in terms of workers' rights, there are very few. I know I'm going on my time for a second, but when a worker is injured or killed on the job, because of workers' comp, they can't sue the employer, even for negligence. And so that's sort of where things are. So thank you.
Thank you, all panelists. Greatly appreciate it. Do any of you want to comment upon what others of you have said, or should we turn to questions? Okay, question from Professor Michael Hillard in Maine. Mark, this will probably be to you, and others can answer. How successful has union-led pushback been on these terrible circumstances in meatpacking facilities in restoring safe conditions? I believe some of these plants, many of these plants are unionized. Have brief strikes been used? And if so, are they effective? And I remember reading that, I believe the head of the Labor Council in Sioux Falls had said, we complained early on that you got to do more, and that Smithfield, but just basically, he said, ignored what folks in labor were saying.
So how successful, I'll do it in 2 parts. I can do the walkout part first. We've all seen the press of these sporadic walkouts. In our facilities, they have largely been, if we've had them, they've just been small periodic ones to address one certain issue that took place in a facility. So they weren't the larger walkout types. But how successful has the union been at trying to change the environment? I got to believe it was the end of February, early March, when we started having discussions with folks in the industry about what we could do to change things. And there have been a lot of changes that have taken place. I will say, I think it's an unfortunate thing. I think it was those first early weeks where it wasn't on everybody's radar screen and CDC was telling us we didn't need certain things, probably cost us valuable time and unfortunately probably cost us lives. But if I look back from today, the changes that we made, which I will not say that they couldn't have been there sooner, because if we had a crystal ball, I would have had it sooner. When I hear these conversations take place, I think it's important we understand how Mark Lauritsen starts his day. My wife will walk out the door in the morning to go to her shift at the hospital, and I have a quiet minute, and the first thing I think about in that quiet minute is I look at the number of people that are infected and the number of people that died, and that's how I motivate my day to start from there. And what has happened over the last 9 weeks, I can wrap up. We had the first 2 plants that closed because of this outbreak, reopened about 4 weeks ago. I think we're into our 4th week of them being reopened. And the work that we have done, and I hate to jinx those plants, but since those plants have yet to have one positive case, since the new protocols have been put into place. I'm certainly hoping it's all helped, but at least 4 weeks in, we're seeing a difference. From 4 weeks from when they opened, we have yet to have one positive case, even though they're in an area where the states that they're in, they still consider those technically hotspots. So I think we got on a track. I can't help but think that we missed an opportunity early on in this crisis. And I think when this was placed on everybody's plate, nobody knew how to exactly respond. And when our federal government, when OSHA just checked out of the process, and when the CDC was giving conflicting responses, that meant we had to go and build a network and a hodgepodge of different events with different employers. And some employers that didn't have unions probably weren't doing anything. We had to build it not knowing what we were building. And this is where we are today. And again, I just think it was just too late. And unfortunately, we have a number of deaths and a number of illnesses that we have to think about every day for the rest of our lives.
Thank you. So a question from Neha Misra of the Solidarity Center. Question for all of the panelists. As this is an issue of an immigrant workforce, could you discuss more how seeing immigrant workers as disposable plays into this, and how we can use this time to push for more workers' rights protections in the U.S. immigration system? Christina, maybe you want to begin and others can chime in.
Sure. I mean, I think that's exactly the right attitude and the right question to be asking. Certainly, the disposability of workers is part of what is at work here, and particularly the focus on workers of color, poor workers, workers who know their rights but are unwilling to assert them because who has the time to wait for a long legal battle while you're unable to work and while you're, waiting for justice. I think we have to dream even bigger and think about what kind of communities do we want to have and build. And I think making connections between different meatpacking communities is really important, because the same disinvestment by companies in the communities that they operate in is what is creating some of these vulnerabilities, right? So whatever the disaster is, right, it's always a surprise, it's always a problem. And so in order to confront whatever those surprising, disastrous things are, whether it's an immigration raid or a flood or COVID-19, in order to be resilient and overcome those things, one of the most powerful methods that we have is solidarity. And, for those of us like Debbie, who's been working with meatpacking since the 1970s, right? This is the same story in many cases across communities and over time, right? These vulnerabilities are not new or surprising. And so what can we do about them is create solidarity. Unions are a great example of how that solidarity can work really well. but it's not the only one. And I think a lot of rural communities have a hard time seeing that big picture because they're like, oh, this is just us. We're so unique. We're so, this has never happened before. There's no model. There's no, right? But there is a model, and there are people with whom you can build solidarity. And I think that's really powerful.
Does anyone else want to add to that?
Can I just chime in
Sure,
with
of
a
course.
few examples? And some of my lawyer peers may not like it, that I think that something that could happen in California, there's actually a labor code that says if an employee believes that their workplace is unsafe, they can refuse to work. And they have to point to a specific, like, I don't have PPE, or I'm going to catch whatever. And Labor Code 6310 and 6311. I suspect that type of worker protection should be in other states, and would provide for either, non-discrimination, and you get your job back if there's any bad act. Also in California, when a worker complains to Cal OSHA by statute has 72 hours to initiate an inspection. And Cal OSHA has to provide that worker with documentary evidence. I think that is helpful. I think it creates kind of a circle of accountability. Maybe attorneys in other states don't like it that I'm sharing this, but I actually, I'm a gal from Georgia, North Georgia. You know what gets processed there. I was in the Merchant Marine for 10 years. I was in the Marine Engineers Beneficial Association. So, for me, seeing some of the things that we do out here, and hopefully, they say as California goes, so do others, whether it's gay marriage or marijuana. I think some of those worker protections that we have here can be translated into other states, and I suspect there'll be momentum around it.
Thank you. A question?
Stephen, I just want to add, NELP actually just put out a paper people can see about
National Employment Law Project, yes.
National Employment Law Project about state and local policies, because the federal government has failed. There are no standards, there are no requirements to protect workers from COVID-19, and they're not enforcing the CDC guidance, which, because I think the industry wrote the CDC guidance, actually is very vague. If you can do this, if possible, if feasible, ideally. But I also just want to answer what Karen said, because I wish what she said was true. But the truth is that workers have a very limited right to refuse hazardous work in this country. The right that she's talking about under California, I think OSHA is under federal OSHA. But I can count on one hand how many times OSHA has sustained a worker's right to refuse hazardous work. They don't have a private right of action. It's administratively handled, and they have to file a complaint within 30 days. And they have to say that they were facing an imminent danger. And, Eugene Scalia, our Secretary of Labor, has decided this isn't enough of an imminent danger that he needs to even establish any requirements for workers. There are better protections for workers who act concertedly under the National Labor Relations Act, but still, if they get fired or retaliated against, it's an administrative complaint under the National Labor Relations Board, and they can decide to dismiss the case. I do think that states should be passing right to refuse language that gives workers a private right of action so that they can sue in court rather than wait for the administration. OSHA has a horrible track record of these kinds of cases where they fine for the plaintiff in a minuscule amount. So I agree with Karen that these rights are really important, and maybe, if there's anything good that comes out of this incredible, horrible crisis, is that people realize how weak worker rights are, and we have to strengthen worker rights, and workers need to be able to have a voice. And the unions, if there's any protection out there, it's because of what Mark and the UFCW has done in meatpacking. But there are plenty of non-union poultry houses in the South, and they're not even getting tested because the governors won't test them. So I do agree with Karen that having a strong right like that is important, but we need to create it.
Hey, Steve, if I want to jump in about the question about immigration policy and things, because I'll start off by saying I've never been an apologist for the meat and poultry industry. but I'm awfully happy that we were able to work with them to negotiate if a plant shuts down or if people have to go out on quarantine, that they continue to get their full pay. And the reason I think that's important is what's going on, not so much in the meat industry, but immigration policy gone bad throughout the country. And that's, the administration has signed this executive order about public charge. And they say, if you become a public charge, you could then have your immigration status re-examined and possibly sent off for deportation. But if you think about it, in today's world, in today's environment of COVID-19, and you want to know why an immigrant worker would face this by going to work when they potentially may be sick, it's because they know if they don't go to work, if they fall off of employment and they fall out of a paycheck, they have the potential to become a public charge, and then their immigration status is looked at and potentially face deportation because of this, of no fault of their own. So when people are out there saying, well, why do workers go to work when they potentially could be sick? Well, if I'm under TPS or refugee status or whatever my immigration status is, all of a sudden I'm in danger because of poor immigration policy that was done even prior to COVID-19. So we have to think about the potential of bad immigration policy and how it may play out, because we're seeing it right now where immigrant workers, refugee workers are now under this fear of becoming a public charge. And that's a problem.
Thank you. Mark, a question for you from Professor Jim Brudney, a collective bargaining question. He says, what are prospects and challenges of using COVID and the concentration of the industry to generate a sector-wide approach to bargaining in the industry? How much of the master agreements from the 1940s through the 1970s might be recreated?
So the professor must have been talking to my brother, because he asked me almost the same question about 2 weeks ago. So in the current collective bargaining environment, we always try to keep a standard throughout the industry. We don't want anybody to get too far out ahead or let somebody fall behind, because we don't want anybody too far behind because it becomes a drag on everybody. So we try to move the whole industry at the same rate. And a lot of what we do and a lot of what we're talking about during the pandemic, if we were to convince one employer to do this, we move that through and we try to get every employer to do the same thing. I know we don't have universal protections throughout the industry, but there are an awful lot of things that we are doing inside the industry that are the same. And I know that there's a lot of my employer counterparts that are on the webinar as we speak. So I would say to any of them out there, it would make my life so much easier if we could all just get together and do master agreements again. So if those employers are watching, I think it'd be a great idea to have them, but that's where we have to keep moving. Just on the economics of this industry, because it's so consolidated, I think to have the economics on a master scale would be ideal for us. Now, I'm sure somewhere out there, there's a employer or an employer representative like Karen, probably has another argument for me, but that's where I would like to see it go.
A follow-up question from Chris Martin of the University of North Iowa. On the flip side of Professor Brudney's question, what are the prospects and challenges of using COVID-19 to somehow break up the concentration of the industry? Mark, Debbie, Michael, do you see any prospects for that?
Sure, I can say just a little bit about this. I think it's a great question. One of the themes, though, that stood out so far in this conversation is that there's not, much political will on the part of elected leaders at the national level, at the state level, to engage in that kind of action. So that breakup of the industry would have to, I think, come from Washington. It would have to be pressure put on the industry at a political level, and it doesn't seem like that kind of pressure really exists right now. At least in Iowa, the governor's office has been very, very deferential to the meatpacking industry. That's been the case, I think, in other states where the meatpacking industry is strong, and we've seen that happening as well in Washington. So it's hard to imagine, as far as I can see, although others might see it differently, hard to imagine a path that would get us from where we are today to that type of outcome.
From my point of view, Stephen, I would tell you, I feel like I could be in a high school debate right now because I could take either position on consolidation. And let me give you two views of it. Consolidation, if we were to break up all the big meat packers and we want to break them up, you could make the argument that that would be good for producers, and it would alleviate this challenge that we're facing now because we're so centralized, and one kink in the chain screws up the whole supply, right? So I could see that argument being made. But on the other hand, if you look at the meat industry, the way that I look at it, and there's beef, pork, and poultry. Beef and pork are highly concentrated. Poultry, not so much. Poultry, you have maybe 2 or 3 that are half of the industry, and the rest of the industry is these small segments. And I'm convinced that those small segments, those smaller operators, are the ones that are dragging that poultry industry back from moving forward. In the union, on the red meat side, beef and pork, if we negotiate a rate, it drags everybody with us. On the poultry side, if we negotiate a rate, there's so much weight pulling it down because there's so much non-union small operators out there that are running dangerous workplaces. They're shaving on worker safety. They're skirting the laws and all different kinds of things that save them that much money, just enough to win a contract over somebody else. So there's pros and cons. I can see good in consolidation, and I can see the reason why we should break them up. So if we want to have a larger debate on meat consolidation, flip a coin and tell me which team I'm on, and that's when I'll defend.
Thank you. So we're going to probably go over time by 5 or 10 minutes. Forgive me. Debbie has her hand up.
Yeah, I was born in the UFCW, I feel like, and work for them, but I do feel like the big companies have such enormous power that it's just way too much right now. And especially in this administration, I mean, it's sort of unbelievable. But I just want to also throw out there, here's the meat industry. All these workers are sick. All these workers are dying. And I would say been killed on the job. You've got no OSHA enforcement at all, no standards. CDC guidance has been weakened and they're not enforcing it. And you have Tyson Foods asking USDA if they can increase line speeds in poultry plants right now. Illegally, mind you, because there's a 2014 rule, but that they said, oh, we want to be able to increase line speeds in 7 of our plants. And USDA says, okay, even though the law says that they can increase line speeds. And you have the USDA also allowing hog slaughter plants in a rule that they issued in March, allowing hog slaughter plants to increase line speeds. They said, even though they asked in their proposal, maybe the USDA said we should think about the impact on worker safety, because when you increase line speeds, every worker just works harder and faster in an industry that already has a very high injury rate before COVID-19 from repetitive trauma disorders. And the USDA writes its rule and said, we don't have to think about worker safety. That's not anything we have to think about. And so the UFCW is challenging that. But I just want to make it clear that the government has jumped in on the side of the industry, continuing to injure workers in many ways. And that in addition, when the president issued the executive order, stunningly, the Department of Labor put out a memo and said, if any worker sues a meatpacking company, we're going to jump in on the side of the employer. So, the Department of Labor is supposed to protect workers from getting injured on the job. And now it's become a department to protect industry from having to protect workers. So that's my
so one last question. This is from Rachel McCleary of SEIU Local 509. What are some concrete ways for people to support workers at these plants, either through or outside of union channels? The potential for political change is too far in the future to help. Are these companies too big and global to care about to be affected by, about to be pressured by boycotts or petitions? Michael, Christina, Karen, Debbie. let's start with Michael, Christina, before.
Yeah, sure. I was going to mention something Christina said in her presentation that really stood out to me, which is that we can think about this, as we often do as consumers, and what can consumers do. But I think we can also really raise the question about what's going on in rural communities at the community level to organize workers who are organized around the needs of workers who are experiencing job disruption, health problems, injuries, immigration pressures in meatpacking plants. And I think that's an area that hasn't been discussed as much as perhaps it should. When I moved to Iowa in 2008, one of the first things that happened when I was here was an immigration raid on a meatpacking facility in Postville, the agro-processors raid. There was, a huge amount of discussion about the legal side of that raid and the impact on workers. But there was also a lot going on in the town of Postville to support families of workers that had their parents arrested as part of that raid, were in need of economic assistance, were in need of food assistance. And I really think that's an important part of that conversation. So to think about what can be done to support workers, we can ask that question of what can be done in those rural towns where these facilities are located by civic institutions in those towns to build solidarity and build support for those workers. It's a theme that Christina mentioned. I think it's a really important one and one that we should think about in the context of this question.
Thank you.
Yeah, I would just, yes, exactly. Thank you. And if you want to get specific, I would say specifically in rural communities, some of the longest term and most impactful needs have been around rural housing and rural transportation. Because if you have a place to live and you have transportation, that means you can access health resources, mental health resources, financial resources, right? Banks, all these kinds of things. And if you don't have them, life is much more difficult and it makes you much more vulnerable. And the vulnerabilities have in part, those rural housing problems, in part, in some cases, have been caused by companies disinvesting from investments that they had made, right? So if they don't own the trailer park that workers work in, then they're not responsible for the living conditions of the workers. But those living conditions have important impacts on worker health when they're in the company and when they're outside and for people who are not working at the company. And so I think focusing on the needs and infrastructures of rural communities that have been long-time needs and that are now exacerbated by this emergency are really specific efforts that people can get involved in. And one of the ways to do that potentially is to revoke the tax relief that some companies have used for a long time as leverage in rural communities, right? So rural communities wanted to attract meatpacking companies to their town, and they said, we'll let you build on this land and we won't charge you taxes for 10 years or 12 years or 20 years or whatever it was. And whenever that was about to run out, like in Perry, Deb Finks writes about this in her book, right? When that was about to run out, the company says, well, if you don't give it to us for another 10 or 20 years, we're just going to move to another rural community that will. So if we can have solidarity as rural communities and say no community is going to give you a tax break and we are going to hold you responsible for the needs that you're creating in our community, that's a really important kind of leverage that is local, but also regional, national, transnational. If we say we expect that companies help support the needs of local communities that they're located in, whether that's bilingual paraeducators, whether that's housing, transport systems, right? You are expected to contribute in the same measure that you are extracting from the communities where you are.
Thank you. Karen, you had your hand up?
I just wanted to say, I think what I've seen, and especially from Sheriff Thompson, in a situation like this, when there is a void of leadership or a void of regulatory compliance, it will be filled. Sheriff Thompson is an example of that. He filled a void. And I think that I hope that whether it's state regulators or the other advocates will see a void will be filled. So you better fill it with what you want it filled with. And I think this applies to a lot of different situations. I certainly wouldn't want anyone that I worked with to be red tagged and on the national news. And so, there's some carrot and stick in there. But I think the lesson with what Sheriff Thompson talked about and the narrative in that town is a very powerful lesson. I kind of wish he was still on here to talk a little more. But I think that's a big takeaway today.
Thank you. So we're over time. We should end soon. So Debbie and Mark, do you want to add anything in closing?
I would add, to answer that question of what could you do to support those workers, vote. And here's why. I am still convinced, and I will always be convinced, that the failure of OSHA to issue an emergency standard in this situation cost workers their lives and made workers sick. When they failed, their number one job is to make the workplace safe for workers. They failed at that. And OSHA knows how to issue an emergency standard. I can look over and see Debbie on the screen and know that when she was at OSHA, they issued an emergency standard on H1N1. They know how to do it. They know how to do it for this kind of situation, and they failed. And because they failed, workers got sick. And what they did, when they issued a guidance, the guidance is full of words like the employer should try, if feasible, if possible. It's a standard that means nothing without an enforcement mechanism. And so if they want to help these workers, all you have to do is vote to put people in that actually give a shit about workers. And when that happens, we wouldn't be having these discussions about sick workers in these meat plants.
Thank you.
I'll just add for 30 seconds, Steve, that Mark is right. We didn't issue an emergency standard, but we enforced the CDC guidance under H1N1, and we made it clear. And I want to make it clear that the CDC guidance that was issued under H1N1, that OSHA had a big hand in writing, didn't have words in it like consider this, because now all employers have to do is consider what CDC is saying and not actually implement it and be in compliance. But I also wanted to go back to the question of what people can do. You know, consumers, when they go to the supermarket, they want antibiotic-free meat. They want like free-range chickens. So consumers can ask, are workers 6 feet apart in every job in that plant? Consumers can start demanding that workers be protected or that they have paid sick leave. And I think what the sheriff said was so important. And first of all, I want you to know that in Colorado, the sheriff refused to close Greeley, Colorado. And because of that, the public health department person has just resigned. But the sheriff was so important in Waterloo. And what he said, and I just want to leave this with all of you.
Sheriff Thompson, yes.
Sheriff Thompson, rather, who I've known for a very long time, is that when you think of meat, you think of, oh, the animals and how are they killed, and the chickens and how are they killed, and that's a big issue. And then you think of, is it organic or is it antibiotic free? But nobody thinks about the workers who actually process it. And I thought the sheriff was so honest when he said, it never occurred to me. It's because we have like a blind spot, because maybe these plants are full of, you know, because they kill, they're slaughterhouses, and we just don't want to know. But hopefully people will now start to think about these workers and, you know, and support them. Thank you.
Thank you. So I thank all of you. I thank you, Michael, Mark, Karen, Christina, Debbie. Thank you, Joel. Thank you, Bernadette, Emily. Thanks so much. This has been a terrific panel. I think it's been very informative and insightful. And hopefully things get better in this industry, and people, and as Mark pointed out, there aren't so many cases in the future in some of these reopened plants. And all of you, I wish you good health and carry on. Thanks very much.
Thank you.
Thank you.
Thank
Thank
you.
you all. This was great. You did
Thanks.
a great
Thanks.
job.